Hey, this is Dr. Anthony Rumsey, and I am with you here with a little video addition to a recent blog post that I posted on the website chiropracticanchorage.com, and that was about something called idiopathic scoliosis. And if you read it, you know that we talked about how very often idiopathic scoliosis, which if you didn't read it, is the most common type of scoliosis. And idiopathic just means that they don't know where it comes from. They don't know what's causing it. We talk about how very often, a lot of those cases, they actually do have a cause, and a cause that's very explainable and oftentimes very correctable. And I just wanted to go into a little bit more depth with people who are interested, who may be dealing with scoliosis with a child, with themselves, what exactly we're talking about at the end of that article when we talk about spastic contracture as the cause of some of these explainable idiopathic scoliosis cases. So let's take a look. We'll use a little bit of drawing to explain this. I think it helps. We all know that at the bottom of the spine we've got a tailbone, especially if you have ever bruised that tailbone. Put a couple little dots on there. You know exactly where it's located. And then flanking that tailbone on the left and the right is the left side of your pelvis and the right side of your pelvis. And on top of the tailbone then, we've got the spinal vertebra, the lumbars, which there are 4, 5. And it is very important from a mechanical perspective that sacrum is level, that tailbone is level, and that the pelvis is level, because especially in a growing child, we need these bones to be able to grow straight up. And what happens in many cases of scoliosis is we have this spastic contracture that we talked about in that article, and that's often not identified by doctors making a diagnosis of scoliosis. And so they tell the patient, well, maybe this scoliosis is bad enough at this point where we're going to do a brace. So let's just kind of wait and see. Let's see if it gets worse, and then we'll do a brace so that we can then avoid surgery. And it's a tragedy because while they're waiting and seeing, they're passing by the point in time that scoliosis is most correctable. And if it is a case where this spastic contracture is causing the scoliosis, very often you can see tremendous resolution of those curves in the spine. So let's get into that. What is spastic contracture? It is a contracture of the muscles that come down on either side of the spine. We'll say this box is a muscle and attaches to the pelvis down here. Left and right, your anti-gravity, your postural muscles, they attach down here to the pelvis, and they also attach to each one of these spinal vertebrae at multiple points. And they keep your posture upright, they keep your pelvis level, they keep your sacrum level, they keep your shoulders level. And as long as those muscles are balanced, they're doing their job. The problem is that in some people, we've got a situation where something is causing those muscles to pull tighter on one side than the other. So we'll do another sacrum and pelvis here, except this time that pelvis is clearly and exaggeratedly tipped down to that right side. And what causes that is that the muscles on one side are tighter and they're pulling harder than they are on the other side. And in a growing child, what results is that these vertebrae, number one, they're not sitting level on top of the pelvis, but, pardon me there, number two, as they're growing, these muscles are pulling tighter on one side, and so the vertebrae want to slip downhill, but they also want to be pulled uphill by the tighter musculature. And so we have this combating force. And what we end up with is a situation where these vertebrae start to curve. And instead of having a straight spine, we've got this curvature in here that, if it stays there to the point where the child becomes fully grown and the bones are mature, that becomes a very permanent thing. And it can get worse as you age because now you've got this very unstable structure here. What we can do, though, is we can identify people who have that spastic contracture. And we do that by looking at, and this is something you can do at home. It's a little bit more difficult if you don't have the right tools, because sometimes they can be pretty hard to detect, but you can look and see if it looks like there is a little bit of tilt in the pelvis, if it's higher on one side than the other. Particularly, you can look if the legs look like they're even when someone's lying on their back. There's a couple other tricks to help distinguish if it's really part of the spastic contracture, if there's something different. But ultimately, that contracture of those muscles comes from the other end of the spine, where we've got the head and we've got the neck, and this top bone in the neck happens to be of particular interest because it's located right where the brainstem and the spinal cord and the brain are intersecting here. So that top bone right here is called the atlas vertebra. And then you've got the second and third and fourth, 7 bones in the neck here. That atlas shouldn't move left or right, but sometimes it does because there's maybe a injury to the head or to the neck. Sometimes that's during the birth process, and there's a misalignment between the head and the atlas, and that causes a problem with this area in the brainstem that's constantly sending signals down the spinal cord to these postural muscles and telling them how to stay balanced and even. And all of a sudden now we've got one side that's contracting tighter, and we've got a tailbone and a pelvis that is tipped, and a child that's developing curves in their spine. Catch it early enough, correct the misalignment up in the neck, take the pressure off the nerves, and these signals going to these muscles begin to be corrected. And you should immediately see a change in that pelvic tilt, and slowly you'll see those curves reduce. Sometimes that can be complete. Sometimes there's a little bit of curvature left. Depends on the individual, but the important thing is that we don't allow those to progress and end up with some more serious deformity or neurological complications that can go along with that. So if you think that might be going on, take a look at your child, take a look at yourself, see if it looks like there's anything funny going on with the pelvis, see if there's anything weird going on, especially with the head and the neck, because often you'll be able to see some head tilt. You'll be notice that there is some, usually some neck pain associated with that. Certainly not always, but it is something that does occur frequently. And if you think it might be the case, go to an upper cervical chiropractor. They're qualified, they're trained to check for this spastic contracture and know how to correct that and correct it properly so that it doesn't become a lifelong problem. Thank you for listening. If you have any questions for me, go over to my website, chiropracticanchorage.com. There's a contact form you can fill out there. Shoot me any questions you may have. In any case, thank you for watching, and we'll be back again with something new soon.